Hi, it's Michelle from Movement Lesson, and I wanted to discuss a little bit more about the hip surgery or the pins that I mentioned in a previous video. Now, first of all, I'm just some lady on the internet, so your decisions medically, whatever, are between you and your doctor. I'm just telling you of things to consider into movements when these things are applied. And now, what I'm about to tell you is the same with AFOs, with pins, with a lot of different options. Even if a child with special needs happens to have a cast for a little bit, this conversation would apply. And again, it's about movement. Okay, change the subject. I take karate. Big deal. I'm just a purple belt. I've got a lot to learn. A lot of people think it's about the repetition. I'm doing the same movement over and over again, so it's just, wax on, wax off. What it is I'm playing. I'm getting a movement vocabulary. I'm increasing my movement vocabulary. So yes, if I get attacked, I have options. I can block, I can duck, I can do lots of things, I can, whatever. I have options. I can kick. That's fine. So that's all that's giving me. So the more options that I have and the more scenarios where I play with that, that's why I spar. I'm 48 years old, I just got kicked in the face by a fourth degree, but it's fun, it's playing. I haven't got seriously hurt, Does it ouch once in a while? Yeah, but again, it's playing. So, but when you play at it, someone's coming at you in something that's not planned. You can plan a center punch as much as you'd like, but to play with it, to use it in real life, and even sparring is really play. It's not hard-on street fighting, and I really don't want that life experience. I'm just going there because I'm playing with my kids, I'm playing with myself for whatever reason. It's something I want to do at this stage of my life. But again, I'm a movement specialist and I have a movement vocabulary. So my movement might be a lot higher than most, or some, or whatever. Are you comparing to women in my age group or whatever? But when you look at someone with special needs, one of the reasons why there's special needs or they have special needs, and this could be for children and adults, is what it does is you have a limited movement vocabulary. There's not enough options that you have at that moment to do the tasks you want to do. It's not about trauma and damage and all that where you like to told with the diagnosis. It's about just being different and doing different. But unfortunately, for lots of things, it just is an option. It's like eating spaghetti with just a spoon. This is just your only option at this moment. If you want the spaghetti to eat it, you got a spoon. Or out of forks, for whatever reason. So, even though a doctor, they don't have special needs, they don't think like this. They prescribe, let's say, AFOs, pins, these, that, and the other. And again, they might feel it's, quote, medically necessary. I get that. But what they're not considering is you're limiting a child that already has limitations. So that's what has to be taken into consideration. So what I was talking about with the pin and so forth, it's about, that ability to roll is just not the same anymore. That ability for acceleration, gravity, it's not the same. Now, again, someone like me, okay, I might have to have surgery, that's great. But I already know how to play with myself and okay, well, I can do it this way, I can do it that way, you can do it this way, I can do it whatever. But a child that already has a limited vocabulary for movement and is not maybe nonverbal on top of it, all of these things start to coming into play. And that's where you might see the crying, the frustration, the pain, the whatever, where new aches start coming up. So it's just something to keep in mind. It's just like if I were to grab you. Do you have options for that? I'm not looking to attack you, but again, that's what I play with in sparring. I attack, I get attacked. It's going back and forth. But again, if you haven't played with these options, some person might get attacked and just freak, fall to the floor, do whatever you need to do, and that's fine. But again, the more you have limitations on those options, just like applying for a job, or if you're a single parent raising 3 kids versus, a single person with no children. You might have options to go to college, whereas you're feeding 3 children. And again, you don't realize what limitations are until you're in that person's shoes. So even someone like me, I can talk all I want, but what you really need to do is just take a moment and put yourself into those person's shoes. Someone that, again, It's not that they're damaged or anything like that. It's just their options are not the same as yours at that moment, period, the end. Can those options change and improve? Yes. You know, that's why you get things like movement lessons, because you want more options to how to eat spaghetti. But at the same time, when there's been trauma, like a surgery, now you expect a recovery, now you expect to, and they're still going through a growth spurt, so now they have to deal with new proportions, weight changes, whatever. That's a lot on a system that doesn't have the options like you or I would have. So it's just something to take into consideration. So think about that prior to surgeries or implementing exterior stimuli, again, like the AFOs, vests, the helmets, and all of that. Can there be other options to have the same goals? So thanks.